Now, how safe is the treatment of IVF? Now, if we talk about the risk of IVF, then we need to know each procedure of IVF and what are the risks associated with it. So, as we discussed before, the first step of IVF was stimulation of ovaries, where we give you injections so that you develop multiple follicles. Now, in this step, the risk or the side effect of the medicines which we are giving you. So there can be mild bruising or soreness at the injection site. You can complain of nausea, vomiting, or sometimes breast tenderness or mood swings because of the side effect of the medicines. Now, once you have these medicines, it may happen that the follicles are not growing. In that case, there is around 5% chance of cancellation of the IVF cycle. There is other extreme conditions called hyperstimulation, that you are growing too much or too many of follicles and too many of eggs. And if that happens, then you have the risk of having water accumulated in your tummy. So there will be increased chance of nausea, vomiting, accumulation of fluid in your body, and in case of severe hyperstimulation, you may need admission in the hospital. The next step of the IVF is the egg retrieval procedure, where we put a needle through the vagina and retrieve all the eggs from the follicle. It may happen, there is a risk of infection, risk of bleeding, because while we do that, we injure ovary or the adjoining blood vessels, though the chances are extremely low. And this may happen that we may not retrieve any of the eggs during the procedure. Then, because usually we put you to sleep while we do the egg collection, the risk of anesthesia is always there. The third step is that once we take the eggs out, we mix them with the sperm in the lab, so which is called the fertilization procedure. So there is a 5% chance of failed fertilization, that is, none of the eggs after mixing with the sperm will develop into an embryo. The chances are reduced if we go for ICSI. The last step of IVF is called the embryo transfer procedure, where we put the embryos into the cavity of the uterus through a very fine catheter. Now, rarely things goes wrong in this procedure. Sometimes you may feel mild clamping while we put the embryo inside the uterus. Sometimes the procedure can become extremely difficult because of the position of the uterus and the cervix. In that case, what happens, if it's a fresh embryo transfer, we freeze the embryo and do a mock transfer. That means we try to find out where the problem is arising and try to put the embryos back at a later stage. In some cases, we do a hysteroscopy to find out the flaws before we put the embryos back. So these are the risk of the procedure of IVF. Now, if you conceive following IVF, there can be some extra risk. The risk of miscarriage, like any other pregnancy, there is around 15 to 20% chance of miscarriage in case of IVF. And if it is done in an older woman, the chance of miscarriage is higher because the quality of the egg deteriorates. Then the chance of ectopic pregnancy, around 3 to 5%, where the pregnancy is inside the tube, in the fallopian tube. Now, you may ask that if I putting the embryo into the cavity, how it is going into the tube? Because once we put the embryos, it floats around the cavity for a couple of days before it gets implanted. So there's a small chance that it can go into the fallopian tube. There is a small 1% chance of heterotrophic pregnancy. That means you have a pregnancy inside the cavity of the uterus. At the same time, there is a pregnancy in the fallopian tube, and it has to be diagnosed properly. Now, multiple pregnancy we think is a complications of IVF because there are plenty of risk associated with multiple birth. If you have more than two pregnancies, that means a triplet, then we put injections in the heart of one of the babies, and we don't allow the baby to grow anymore. The reason behind it makes the pregnancy very complicated. Now, the risk of multiple pregnancy are to the mother is a high blood pressure, increased chance of diabetes during pregnancy, increased chance of bleeding during delivery, increased chance of having a cesarean sections, or there is an increased risk of preterm delivery. That means having a delivery before the expected date, or having a low birth weight baby. Some people ask that if I have a IVF, is the baby has an increased risk of birth defect. Now, whatever data, long-term data we have, the birth defect of babies born by IVF and natural conception are the same. Then some people say if we go for IVF, we are taking lots of injections and lots of eggs are forming in the ovary. Is there any risk of ovarian cancer? Now, whatever studies we haven't found any risk of ovarian cancer in patient going for IVF. And the other thing which we have to take into consideration besides this physical thing is the emotional part, or the stress associated with IVF. And some people say, it is extremely draining physically, emotionally, and yes, of course, financially. So before you go for IVF, you can take help of counselors about this emotional part, or you talk with your family, you gather your support, and then you get ready for the IVF procedure.